Hey, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. Today I have a little bit of a different presentation for you. I'm going to show you one of the PC textbooks that are part of Terra Medic, but we're going to talk about the drug administration routes that is common for EMS and even outside of EMS. The one thing, of course, is always to check your protocols, because some drugs you can give some ways in certain protocols, and other drugs you have to give it a different way. So always check your protocols on the proper administration route for your med control and what you're allowed to do. So I'm going to quickly just go over to the file. So let's go take a look. Okay, so here is the file I was talking about, the digital textbook here, and just going to go over again, like I said, some of the routes of administration. And like it says here, we give it for a variety of reasons, a variety of methods, because some drugs are really only effective when you give them a certain way, right? In particular, a certain dosage, a certain way of giving to the patient, because you're not going to give somebody a large dose, say intramuscularly or sub-Q, right? So we have to understand the different routes and what they do and what can be given in those different ways. And this will help us understand when we're giving a drug sometimes that maybe, it can kind of, I guess it can kind of help you understand that if you're sitting there trying to give 10 cc's of a drug sub-Q, that you're doing something wrong. You need to go ahead and check and make sure that you're not missing something, right? So oral, of course, is a popular way. We don't give too many things orally in EMS. Aspirin is one of the big ones, but other than that, we don't really give in EMS a lot of drugs orally, right? But we do give some things sublingual, and of course the most popular one that we give sublingually is nitroglycerin, right? Very popular way to give that drug. And this is something that the patient does not swallow. It's still considered oral, but it's not swallowed like a pill would be. And we usually will give it to, it goes under the tongue in the form of, let's say, a nitroglycerin tablet or a nitroglycerin spray, let's say, okay? And you can see it too. Another way is giving it into the pouch of the cheek. And I have seen this done, but it's not a common way. Most people will go ahead and give it to them by having the patient lift up their tongue and spraying it there, okay? And of course, this is rapidly absorbed and doesn't have to go through the gastrointestinal tract. Now, rectal is another way. We do give a few drugs rectally. Normally, those are anti-seizure type drugs that we're going to give, and a lot of times it's more directed towards the pediatric patients where we don't have that great of an IV access, and maybe starting an IO isn't the best way to be giving that type of a drug. Now, again, not as well absorbed, okay? Let's say if we're giving it sublingually, but the problem, I think, with the rectal is, like it says here, it can be a little unpredictable, okay? And vary among patients depending upon where, I guess the amount of drug you're giving and how much actually gets absorbed into the rectum when you do it. Okay, vaginal is something we don't do in EMS. Inhalation is something we do. Okay, this is the type of drug where you can, well, nitric oxide is something mentioned here, but that's not in all protocols. A lot of times we're not giving that type of drug. We're thinking more along the lines of albuterol, ipratropium, things like that is more the inhalation type of a drug that we're giving. Okay. And you have to look out for some of the absorption into the circulatory system when it comes into that. When you give certain drugs, how it can affect the circulatory system as well. Okay, topical. This is something we're not really giving a lot of topical drugs. Not something we're really doing in EMS, but the most popular one here, of course, is the parenteral, right? This is the drug that avoids the gastrointestinal area, and they're all these injectable types of drugs. It allows for a more rapid administration, rapidly absorbed into the patient's body. Okay, so this does have some disadvantages, of course, because we're giving a needle, right? It's not all that convenient. We can't always get the IV access, but it is, for us in EMS, the most popular way, I would say, that we're giving drugs. And of course, I consider this IV is the most popular part that we give. Intra-arterial, that's something you might see in an emergency room, but we're not really using that in the field. Um, and we're not using spinal type injection, but we do use intramuscular, right? That's, I mentioned that earlier. We do use subcutaneous as well, and I mentioned intraosseous also. Okay, but I think that falls under the IV, sort of IV umbrella when it comes to intraosseous. But sub-Q is one way that we're doing it, and intramuscular. Now, intradermal, this is at the very few top layers of the skin. Not something we do in EMS. Don't get that confused with subcutaneous or intramuscular. All right, guys, that is it for today's Monday Minutes. I hope you can use them. Let's go back and just close this out. Okay, so like I said, this is just a real short Monday Minutes, but again, we just want to remind you guys that you have to think about the route that you're giving a drug, right? It's one of the R's you have to check, right? The right patient, right drug, right administration, right route. So make sure that you check that, okay? Not just for the drug itself, but also for the protocols that you're using. Some protocols will allow you to give something, let's say like epi, zero point 0.3 of epi. Some protocols will let you give it IM, and others are strictly sub-Q. So check your protocols and make sure that you are giving it the right way. Guys, if you want to see more content like this and you feel this can help you study and pass exams, go check out Terra Medic On Demand, guy. It really is a all-in-one resource to help you pass exams and succeed in your career and achieve the goals that you're trying to achieve in EMS. Okay, it goes beyond just the basic training that you'll get in your paramedic class and continuing education. Okay, this is the type of thing that can help you really build confidence, not just in your exams, but also when you're doing your clinical assessments and you're giving reports to doctors and nurses and things like that. So go check out how you can actually use Terra Medic and how you can put it to work for you and help your career and your next exam that you're going to take. Okay, click the join button here on the bottom. Go get some more details there. There's even a free download you can check out as well on the homepage there. All right, so go check that out, guys. I thank you for watching Monday Minute. I really appreciate it. Go check out EMS Office Hours as well. Leave some comments in the blog and right here on YouTube as well. Let me know what you think about these Monday Minutes. If you have some ideas of your own or something you want to see here on the Monday Minutes, be sure to send me an email. It's jhoff@emsseo.com, and I will try to get a Monday Minutes created on a topic that you like. And if not, if it's a bigger topic, I might even make it into a full 1 hour podcast on the show. So until next week, guys, as always, Jim Hoffman for EMS Office Hours. Stay safe.